Lumbar spine. In human anatomy, the lumbar vertebrae are the five vertebrae between the rib cage and the pelvis. They are the largest segments of the vertebral column and characterized by the absence of the foramen transversum, as it is only found in the cervical region. General characteristics. Body are characterized by having a vertebral body fat compared with other vertebrae. Foramen. The spinal hole is triangular, being longer than the thoracic vertebra, but smaller than the cervical. A spinous process, quadrilateral shape. Two transverse processes are called appendices costiformes. Four articular apophyses, two upper and two lower. Two pedicles, high thickness. First and fifth lumbar vertebra. The first lumbar vertebra is level with the anterior end of the knee rib. The fifth lumbar vertebra is characterized by its body being much deeper in front than behind, which accords with the prominence of the sacrovertebral articulations. Sacralization of the fifth lumbar vertebra is a congenital anomaly in which the transverse process of the last lumbar vertebra fuses to the sacrum on one side or both, or to ilium or both. Low back pain. Low back pain is pain that is localized in the lower back, but often radiating to the buttocks and thighs. Usually subsides with rest, with application of head and hand massage, and with the action of analgesic.
The spine is made up of five vertebral bodies in the lower back. Nerves travel through the spinal canal and exit through the openings on the sides of the vertebrae called the foramen. Here you can see the thecal sac containing the nerve roots and the nerve root going through the foramen. Here you can see the transverse process of the spine. Lumbar canal stenosis is a narrowing of the spinal canal, which may cause nerve impingement. It can occur in the central canal, lateral recess, or at the foramen level. It is a common cause of low back pain. Normal lumbar spinal canal is more than 150 millimeter. Degeneration of the spinal canal and thickened ligamentum flava will cause stenosis. Absolute stenosis when the spinal canal is less than 100. Degenerative changing involving the thecal sac, the facet, and the ligamentum flavum will cause central stenosis. Lateral recess stenosis. It occurs because of narrowing and compression that occurs between the sac and the medial pedicle wall. It affects the transversing nerve root. What causes it? Superior facet, facet capsule, and disc hypertrophy and degeneration. The foraminal stenosis affects the exiting nerve root. For example, if it happened at L4, L5, so it's going to affect L4 nerve root. It occurs lateral to the medial pedicle, and you'll find that there's a lot of facet enlargement and overriding. We call it foraminal stenosis. Diagnosis: back pain, leg and buttock pain from proximal to distal. Patient may complain of neurogenic claudication. Patient is usually neurologically intact. Radiological diagnosis. MRI or CT myelogram is important. The absolute stenosis when the spinal canal diameter is less than 10 millimeter. Lumbar spinal canal stenosis. Differential diagnosis. It's either a hip disease or a vascular disease. When there is a vascular disease, the pain starts distal to proximal. The pain starts in the calf or in the leg. The pain is relieved when the patient stops walking, and when you examine the pulses, you find they are either reduced or absent. The neuro versus the vascular claudication is important. Neurological claudication versus vascular claudication. The first one will be neurological claudication. The second one will be vascular claudication. In the neurological claudication, you'll find vague pain beginning in the lower back, proximal. The vascular, there are the tightness and the cramps in the leg, in the calf. It starts distal. The neurological is proximal to distal radiation. The vascular, calf pain. The neurological is worse with extension of the spine, with standing, and very rare with bicycling. The vascular worse with walking, bicycling, and much better when you stop walking. Why that is? Because when you do extension of the spine, it narrows the foramen by 20%. It reduces the space available for the foramen by 20%. When you do flexion, you improve the size of the foramen by 12%. That's why flexion is good for neurological claudication. In neurological claudication, uphill walking is less painful than downhill walking. In vascular claudication, uphill and downhill walking is very painful. Always check the pulses. Neurogenic and vascular claudication may coexist. Bicycle test. The patient rides and walks a fixed distance. The patient with a spinal stenosis will show symptoms with walking but not while riding the bicycle, because he's flexing his spine when he's riding a bicycle, so the pain improves. The patient with vascular claudication will have pain while he's walking and while he's riding the bicycle. Posture doesn't mean anything for a patient with vascular claudication. Treatment: non-steroidal medications, physiotherapy, bracing, epidural injection, or surgery. Indication for surgery usually for persistent pain that's not improving by conservative treatment. Procedure: laminectomy and partial fascicectomy with or without fusion. Fusion is done for instability and for degenerative spondylolisthesis. All my videos.
Sacralization.
The human spine is made up of 24 spinal bones called vertebrae. The vertebrae are stacked on top of one another to create the spinal column. The spinal column gives the body its main upright support. From the side, the spine forms three curves. The neck, called the cervical spine, curves slightly inward. The mid-back, or thoracic spine, curves outward. The outward curve of the thoracic spine is called kyphosis. The low back, also called the lumbar spine, curves slightly inward. An inward curve of the spine is called lordosis. The lumbar spine is made up of the lower 5 vertebrae. Doctors often refer to these vertebrae as L1 to L5. The lowest vertebra of the lumbar spine, L5, connects to the top of the sacrum, a triangular bone at the base of the spine that fits between the two pelvic bones. There is a joint on each side of the sacrum that connects the sacrum to the pelvis. This joint is called the sacroiliac or SI joint. Each vertebra is formed by a round block of bone called a vertebral body. The lumbar vertebral bodies are taller and bulkier compared to the rest of the spine. This is partly because the lumbar spine has to withstand pressure from the body weight and from daily actions like lifting, carrying, and twisting. A bony ring attaches to the back of each vertebral body. When the vertebrae are stacked on top of one another, these rings form a hollow tube called the spinal canal. This bony tube surrounds the spinal cord as it passes through the spine. Just as the skull protects the brain, the bones of the spinal column protect the spinal cord. The spinal cord extends from the brain to the L2 vertebra. Below this level, the spinal cord splits into a bundle of nerves that goes to the lower limbs and pelvic organs. The Latin term for this bundle of nerves is cauda equina, meaning horse's tail. As the spinal cord travels from the brain down through the spine, it sends out nerves on the side of each vertebra called nerve roots. These nerve roots join together to form the nerves that travel throughout the body and form the body's electrical system. The nerve roots that come out of the lumbar spine form the nerves that go to the lower limbs and pelvis. The thoracic spine nerves go to the abdomen and chest. The nerves coming out of the cervical spine go to the neck, shoulders, arms, and hands. It is sometimes easier to understand what happens in the spine by looking at a single spinal segment. The spinal segment includes two vertebrae, the intervertebral disc between, the two nerve roots that leave the spinal cord at that level, and the small facet joints that link each level of the spinal column. An intervertebral